Hello, this is Mike McLafferty. I'm the CEO and founder for MJM Advisory and Educational Services. Welcome to this week's Healthcare Current Event Update. We want to focus this week on merger and acquisition activity in healthcare, in particular for the year 2020, the pandemic year. What might be surprising to a lot of you is that merger and acquisition activity did not come to a halt during 2020. In fact, in 2020, there were 79 transactions considered M&A, and that's compared to 2019 when there were 92 transactions. So there was a reduction in the number of transactions, but it's fair to say that the M&A activity was still fairly brisk in 2020. Also, and these figures are coming from a Kaufman Hall study, there were 7 mega mergers in 2020, and Kaufman defined a mega merger as 2 organizations coming together, each having over $1 billion in annual sales. One of the things we noticed that came out of this year is healthcare organizations realized how important it is to have appropriate financial resources on hand when there is some sort of economic impact to the business. The other thing that became obvious during 2020 is a lot of collaboration and community efforts in healthcare to try to deal with the pandemic and the impact that it had on the organization. A couple of other things that got highlighted during 2020, the importance of healthcare organizations focusing on their core strengths and also any infrastructure gaps. Infrastructure defined as an issue having the appropriate number of people, efficient work processes, being in a position to take advantage of technology, and lastly, having enough space to actually run the operation. A BDO did a survey of healthcare CFOs, and they found that 44% of those came back and said that 2020 put them in a position where they were partnering more with other healthcare organizations to get things done. Also, 41% of CFOs indicated that they actually are moving closer to consolidation as a result of the 2020 year. But 2 things that were always a competitive advantage to any organization, not just in healthcare: intellectual capital and expertise. This became something that these 2 items are really highlighted during the 2020 pandemic as key competitive advantages amongst various healthcare organizations around the country. Also, it became pretty obvious that regional hospitals, for example, were developing partnerships with either academic medical centers or teaching hospitals, and academic medical centers started working closer with pharmaceutical firms. Some of the things that were key to success for providers in healthcare in general, taking advantage from a technology standpoint of telehealth. The whole idea of a virtual visit became prominent during 2020 and even continues today. And I think most people in the industry will argue that going forward, there'll probably be some sort of a hybrid approach where patients can take advantage of virtual or in-office type visits. Developing and disseminating clinical protocols was considered an advantage during the pandemic. Being able to deal with supply chain interruption. This was a very big challenge for a lot of healthcare organizations. For example, just getting personal protective equipment or PPE for staff. A lot of the normal suppliers rather, were either unable to get any of that equipment or weren't able to get enough volume. So there's an effort throughout the industry to find alternate suppliers of this equipment. And lastly, innovation. Um, Innovation in the sense that all these healthcare organizations were presented with challenges they had never seen before prior to this pandemic, and any way to think differently. And again, that could be with partnerships with other people. It could be using technology, a combination of two. But there was a need to come up with solutions that were unique and maybe first-time type solutions than ever before. These items I just mentioned were really critical for success for providers in healthcare during 2020. And I would argue, we would argue rather, that continued in 2021. The other thing that feedback we got from a lot of organizations out there was the need to divest service lines or service offerings that are unprofitable. Probably something most financial people in healthcare would argue should be looked at on a constant basis, but it's not unusual for healthcare organizations to have service lines that they feel the community needs, but at the same time are unprofitable and are taking funds away from the organization, whatever their normal core competencies are. What we saw here is that BDO speaking to, again, CFOs in healthcare for this current year, 2021 and going forward. They came up with 4 areas that they felt would be highly listed as far as potential divestitures. Behavioral health was number 1. Some organizations even were looking at virtual healthcare as something that for them was unprofitable, probably because of a lack of volume and maybe a lack also of technology that they could use for virtual healthcare. Retail properties, any organizations that had investments in this area got hurt. The retail industry, as we know, got hurt very badly during the pandemic. And post-acute care was another area that CFOs felt pretty strongly would be divested. Maybe some other potential here for these 4 items could be partnering with other organizations or just outright eliminating the service line to be offered. Physicians hit the hardest during the pandemic year, are looking now for more financial stability. And we have seen in the Northeast in particular, a lot of private equity activity amongst specialty groups. They seem to be open to talking to these folks, and we expect a lot of movement in private equity to continue in 21 and probably also in 2022. 2021, we believe, based on the information we've seen here in our research, is going to be even a stronger year for M&A than 2020. And we see a continued consolidation of the industry amongst hospitals, health systems, and physician organizations. Thank you very much for watching our weekly healthcare update. We hope to see you soon. Take care.